good evening to all of you. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you this must be doing really good. Today, as we stand towards the end of June, and as we keep you reminding that June is not just a month, it's also Acne Awareness Month. So we are here once again to discuss acne management. Now, acne is something, which bothers most of us, especially during teenage or adolescence, when a person attains puberty, because a lot of hormonal change happens. So acne is what welcomes the change. Then we have adult acne. Then those who have oily or acne prone skin, they know how difficult it is to deal with acne and to deal with the post acne pigmentation, scars, marks, pits. So today we are here to discuss about acne and acne management. We'll try to understand what is acne, what are the various types and grades, why it is important to go and consult a doctor, a qualified dermat in case we have acne, and what to do and what not to do. Because those who had acne, they'll agree with me. We love popping or squeezing our acne because we feel that this way we'll get rid of it quickly, or else there are so many things that we do which should not be done, like touching our acne or face again and again, and doing home remedies, applying a number of things on our acne, or going for over-the-counter topical application, which could be really harmful, or go by what the influencers on various social media platforms are asking us to do. So better than going for all these and wasting our time, energy, money, and most importantly our health, our skin, it's always better to approach the right person, and in this case the right person is a qualified dermatologist. And today, as our skin expert, we have with us Dr. Bhawna Lochav. She is going to join soon, and she's a renowned skin expert from Delhi. Before she joins, let me tell you more about her. Dr. Bhawna Lochav, a dedicated dermatologist with a strong academic background and extensive clinical expertise, embodies a commitment to providing exceptional patient care, holding an M.B.B.S and M.D in dermatology along with the D&B certification. Dr. Lochav has honed her skills through roles at prestigious institutions like Indira Gandhi Hospital and Pacific Medical College, and currently serving as an associate consultant at Heal and Glow Skin and Hair Clinic, Delhi. She excels in diagnosing and managing a wide spectrum of dermatological conditions. Dr. Lochav's passion for dermatology is matched by her proficiency in procedural dermatology and aesthetics, making her a valued practitioner in her field. So today we are going to talk about acne and how to manage acne, and for that, of course, we'll have our skin expert, Dr. Bhawna Lochav, soon with us. So she is joining soon, but before that, let me tell you what all we are going to talk about acne today. First, we'll try to understand why it happens. Then, in case we have acne or acne prone skin, what to do and what not to do, what are the basic skincare routine that we can follow. What happens these days? We all fall for n number of products that's there in the market, and market is flooded with products. Unless and until we start seeing the results, the worsening of our skin or various skin conditions popping out on our skin, we realize that these experiments were not that good. That's why it's important to understand why you need to know about acne, why the awareness is required. And June, as I said, is also the month for acne awareness. So that makes it even more important to understand what is acne, what are the various types, and why and how can we manage it. So we are here to discuss more about acne. Acne vulgaris is a common chronic skin condition affecting more than 85% of adolescents. Young adults also get affected. Then adults also get affected, especially women during their menopause or various, hormonal changes. They also see a lot of acne, and such cases are rapidly increasing these days. Yet despite its prevalence, there are still widespread misconceptions and stigma surrounding acne. That's why June serves as a beacon of education and empower individuals to seek effective treatments. So today we are diving into the topic of acne management, and we have with us renowned skin expert Dr. Bhawna Lochav. A very warm welcome to you, Dr. Bhavna. So yeah, once again, what is acne? What are the various causes and various types?
See, acne is basically a chronic inflammatory disorder which usually affects our face, but yes, it can also affect our backs, which we in medical terms call as acne purpuris. And normally, the most common form of acne is called as acne vulgaris. So we have four grades of acne. In grade one, we mostly have comedones. Comedones we commonly call as black or whiteheads. See, basically the pathogenesis of acne is that there is a lot of oil secretion normally on our faces. We have a lot of sebaceous oily glands. So what happens is this oil is not able to come out on the surface. It stays inside our skin, and we have various bacteria like Propionibacterium acnes and a lot more. So they basically stay in that sebum and then they infect. They cause a lot of proliferation, which is outside visible as pustules or what we call as pimples, right? So in grade 1, we usually have comedones, which are white or black heads. In grade 2, we have those small red bumps and a few pustules maybe. In grade 3, we have a lot more pustules. And in grade 4, we have a lot of cystic acne, which is very painful for a lot of females. And also, they occur more around the cycle, around in females around the period cycle. So, these are the four grades of acne.
Right. Doctor, what happens, when we have these acnes? Because it is definitely related with our appearance, our skin, but then deep down it affects our confidence level as well. Many people go into depression when they have acne and chronic, acne. We either go for home remedies or we go for over-the-counter topical applications, and initially those topical creams work wonderfully. Later on, we realizes that we are big addicts of those creams. We would like you to clarify why these home remedies or going by the over-the-counter medication can harm us.
Yes, see, all these home remedies, for example, applying toothpaste. It's a very common remedy which I hear in my OPD. Like patients tell me, मैंने तो toothpaste ही लगाया था, but कुछ असर नहीं हुआ. It will not affect
Right.
you. It will even cause you harm because what toothpaste does is it will destroy your skin barrier. And if your skin barrier is destroyed, nothing can actually help you with your acne because it will. You think that toothpaste is gonna dry that pimple, but yes, people see results like it can dry up for maybe 1 or 2 days, but then it will recur definitely because that will destroy and damage your skin barrier, which is very crucial in the management of acne. Because if our skin barrier is healthy and it is normal, then definitely the flares and recurrences of acne they decrease. So DIYs are a big no-no because they basically form a layer on your skin and even they clog your pores even more. So please do not go for any DIYs or any. Please consult your dermatologist if you have acne or any other skin issue.
Right. And what about the tube, the topical application that we get from our nearby chemist shops, and we keep on applying them, and then we see, thinning of skin or facial hairs growing in numbers. So how bad they can be?
See, that's because facial hair, redness, that's all because chemists or what these people do is they give you steroids, topical steroids. And topical steroids are the major cause of causing you a lot of facial hair, facial redness, those thin veins or thin capillaries visible on your skin. Because steroid, what they do is they cause skin thinning. For the moment, like if you apply it for 5-10 days, it's gonna definitely decrease your acne. But you will get dependent on that steroid or on that OTC cream. So that steroid is gonna harm your skin in the long term because it will cause skin thinning. So please do not use any steroid creams. Please check. For example, in commonly given creams by chemists, it is Flop G, which has clobetasol, which is a very potent steroid. So you should not never use that steroid cream on your face until and unless prescribed by a dermatologist, of course.
Definitely. When a patient comes to you with acne, do you recommend tests for diagnosis, or just by clinical investigation you are sure that this is the acne, probably this is the cause, etc.?
See, in 90% cases, just by looking at the face, I'm pretty sure that this is acne and how will I manage it. But yes, definitely in cases who have acne predominantly over the jawline or over the chin, that might be a cause of hormonal acne, right? So that hormonal acne needs to be evaluated. If the patient has underlying PCOS or PCOD or thyroid disorder or any other hormonal issue. So in majorly in those cases only I go for tests. But yes, if the patient has a lot of nodular cystic acne or cystic acne entirely over the face, then also for starting my treatment or for starting any oral medicine, I might also recommend some tests. But yes, in most cases it is clinically I'm clinically mostly sure that this is acne vulgaris.
And doctor, now we would like you to shed some light over the treatment options available, the procedures available for acne and post-acne pigmentation, scars, fits, etc.
See, for acne, we have medical therapy and we have procedural therapies, right? In medical therapies, we have oral medicines and we have topical application drugs. In oral medicines, we have doxycycline, we have isotretinoin, but yes, both of these drugs are completely unsafe for pregnant and lactating women. We do not give these drugs in pregnant or lactating women. So please, 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 whenever you go to a dermatologist, please clarify or please ask her that if you are pregnant and if you can take those drugs safely. Other options in drugs are like it can even be put on tablet azithromycin, which is actually an antibiotic, but it definitely helps in acne as well. So these are the major oral drugs or oral medicines which we use. Topical application is a wide list. But yes, I'm going to name some drugs. Like if you have majority pustules, then you can use a gel which is called a clindamycin gel. It also comes in combination with benzoyl peroxide, which helps in drying of acne a little faster. So if you can apply, then you can apply a combination of clindamycin and benzoyl peroxide. But yes, it causes a lot of burning. So please make sure that you apply it for a short period, not for like 1 hour or overnight application. Then we have topical retinoids, which includes adapaline, tretinoin. Depending if you have a lot of comedones, then retinoids are going to be more beneficial to you than any topical antibiotic. Then we also have other drugs like topical minocycline and a lot many more. But for that, you actually should visit a dermatologist because they can actually even see your skin, what is going to suit you. Because, for example, if your skin is very sensitive and you apply a retinol or if you apply salicylic acid, so it's going to even damage your skin barrier even more. So you should be really careful while applying any topical drug because you don't want any harm to happen rather than good. Uh, Coming to procedural treatments, for acne, we can go for comedone extractions. For example, in type 1 or grade 1 acne, grade 1 acne is basically we have a lot of comedones. So we, in the first sitting, only go for comedone extraction. Right? So comedone extraction really helps because for comedones, which are like white spots under the skin, so any drug or any oral or topical medicine works a little less there as compared to other pustules or papules. So we usually go for comedone extraction in that stage. In grade 2 or 3, we can go for chemical peels. There are a lot of peels available these days, which are salicylic acid based peels or azelaic acid based peels, mandelic acid peels, right? So you can go for that. And also there is a treatment called as carbon peel. In carbon peel, we use a laser to actually help you with acne. We apply a layer of carbon and then we remove it or by a Q-switch anti-ag laser. So that is also helpful in reducing oil secretion by your sebaceous glands. So that is also
Right.
a wonderful option.
So a lot of treatment options, a lot of procedures are there. What is important is to go to the right person, which is a qualified dermatologist in case you are acne. The first place you need to go to the doctor and then trust your doctor, get the treatment done. Now, doctor, would you like to suggest some basic skincare routine that we can follow and take care of our skin, especially if we are acne prone or have oily skin?
See, for oily skin, you can definitely use a salicylic acid based serum. Salicylic acid, what happens is salicylic acid, it unclogs your pores, it decreases your oily secretion. Also, salicylic acid has a benefit that it can be used both in the morning as well as in the evening. It does not, it's not photolipide. Right. Second active ingredient is niacinamide. It's a wonderful ingredient. Niacinamide also helps with redness. It will also help you with marks. Then these days there's also azelaic acid serum available. So depends. If you have sensitive skin, then you should ideally go for a niacinamide serum or an azelaic acid serum. If your skin is not sensitive and it is on a tougher side, then you can definitely go for a salicylic acid based serum or a retinol based serum as well. But retinol is to be only applied at the night and not in the daytime. But in the day, you should definitely cover up with the sunscreen because retinol will cause your skin to be a little sensitive to the sun. So you should ideally apply sunscreen at 9 a.m. and 11 a.m. two times at least in the morning.
Right. And doctor, does diet have any connection with acne or dairy products, etc., any dietary precaution that we need to follow?
Yes, definitely. Diet has a definite role with acne. See, for example, all the high glycemic index foods like rice, milk, all these things, sugar especially, sugar, chocolates, all these junk foods. What happens is they cause a lot of insulin spike whenever we have that. So insulin spike directly leads to inflammation, leading to increased oil production by our glands. So we should, people who have acne should definitely take a low glycemic index food diet and not a high glycemic index food diet.
Right. And doctor, before we sum up the whole session, any take-home message for our viewers?
See, I would say, especially for people who have teenage acne, please consult your dermatologist ASAP. Because, see, what happens in teenage acne is that there is a very high tendency for scarring. And then for scarring, you have a different whole line of procedures. So, I would say prevention is better than cure. So, please prevent your scars to form so that you won't have to go for any other procedure or any other thing. So, please treat them early, ASAP. Also, with women who have hormonal acne or more of acne towards the lower side of the face, please get it tested, please get it treated because that will also affect the rest of your organs and that you will be able to diagnose your condition like PCOS or PCOD very early and it is a very treatable condition. So, yes, definitely, I would say please consult your dermatologist ASAP.
Right. So, in case you have acne or any other problem, please go to the right person, which is a qualified dermatologist. Thank you so very much, Dr. Bhavna. It was wonderful talking to you. Thank you for making this session so informative as well as interesting.
Thank you. Thank you.
And viewers, thank you for joining. Stay happy, take care of yourself, and have a great evening ahead. Goodbye.